Hi, my name is Dr. John Green, and I practice at District Medical Group and see patients at Peoria Valleywise Clinic. And I'm going to talk to you today about injuries of the knee. Injuries of the knee are very common, and whether it's when you're playing soccer or some other sport, or it's something that happens when you're walking in the yard or stumble on the street, whatever it is, whenever you're injured and generally you find yourself on the ground, then you want to do a little checklist to see what the matter is and see how bad it might be. Because as soon as you hurt yourself, your initial reaction is, oh, wow, this is terrible. But then after a minute or two, when you get your wits about you, then many times there are things that you can walk off. So the first thing to notice as you're looking down at your leg is, well, is it lined up straight? When things are not lined up straight, then it's either dislocated or broken, and those are emergencies that require emergent treatment. So if you see something that is pointing in the wrong direction, then you need to go to the emergency room. If your leg is floppy and pointed in a bad direction, then it's broken. And if it's stuck, then it may be dislocated. After things look good, the next thing to test is to see if you can move your toes. If you can wiggle your toes, then you can move your foot and then start moving your leg and your knee, and if that seems to be okay, then you can go ahead and stand up and see if you can bear weight. Try bearing weight when you're standing still. And if you can bear weight, then you can walk it off and see how things go. Injuries generally have swelling, and the timing of the swelling will tell you as to the severity of the injury. Fractures generally start to swell immediately. Big ligament injuries like the ACL swell in an hour or so. Meniscus tears swell over a few hours. Other things swell more slowly. So the faster it swells, the more chance that you have a more significant injury. And if you notice swelling in the knee, that's also something that needs to be checked out. And you should see your physician or see me about that. The next thing to look at is tenderness. And so you can push around the knee and see if there's any particular part that is sore. Frequently, the places of injury are more tender to touch and will be obvious to you when you touch them. And so that can be very helpful in determining what is actually wrong with your knee, is to find out just where in the knee is hurting. The basic treatment of a knee injury is rest, ice, compression, and elevation. And doing simple things like straight leg raises. A straight leg raise is contracting your quadricep muscle, the big muscle in the front of your thigh, with your knee straight and lifting your foot off the ground a couple of inches and holding it there for a count of 10. That's a great exercise for any knee injury, and so that's something you can start very soon after the injury, as soon as it's comfortable.